Hello, everybody. My name is Daisy Aldana. Today, I'll be presenting to you about muscular dystrophy. And it's one of the diagnoses that I have been assigned to do. So, a little background about a muscular dystrophy, which is also known as MD. So, this is a genetic neuromuscular disorder, which is passed down by parents. So, there's different kinds of muscular dystrophy, but the ones I'll be focusing on, I'll present on my next slide. So, what muscular dystrophy is, it affects muscles, but not nerves. It can cause muscle weaknesses, strength, body movements, and control. So think of it as muscles wasting. So it's a muscle wasting disease that affects the trunk muscles, the leg muscles, the arm muscles, the heart muscles. So it's primarily a progressive disease. And according uh, to one of the quotes here, muscular dystrophy are due to absent muscle protein product called dystrophin, which is a protein involved in maintaining a healthy muscle. So that particular protein, because of lack of that protein that supports maintaining of that muscle is lacked in individuals who have MD. So the responsible genes and biomedical abnormalities can be tested through a muscle biopsy to determine the level of absence of dystrophin. So there's tests done in order to see the extent of how much of this protein is lost in order for it to support the muscles. So the two types of muscular dystrophy that I'll be presenting here is Duchenne muscular dystrophy and Becker muscular dystrophy, which these two types of MDs are very common in children and as well as adolescents, which I'll go more in detail. So Duchenne muscular dystrophy, DMD, is a genetic disorder characterized by progressive muscle weaknesses and degeneration of skeletal muscles that control movement. DMD is classified as a dystrophinopathy, is a result of deficiency of a protein called dystrophin. So back to what was mentioned, because of the lack of the protein, the muscles are slowly deteriorating. DMD is typically inherited through the mother. However, there have been occurrences where individuals are diagnosed without having family history. So one thing to realize about MD, it is very common in males, but not saying that it's not common in females, but it's mostly very common in males. And one of the most, I guess, known or popular ones that people are diagnosed with would be Duchenne muscular dystrophy. As far as Becker muscular dystrophy, PMD is closely related to DMP, MD, has similar symptoms and genetic causes. The difference between them is a rate of progression of symptoms and health complication and appears so in late childhood or adolescence. So the difference between these two, Duchenne muscular dystrophy occurs at a younger age, around could be early diagnosed as 2 to 3 years old. And for Becker, it's kind of late childhood or adolescence, so later down the road where they're diagnosed with this disease. So as I mentioned earlier, DMD affects approximately 1 in 5,000 live male births, and estimated about 20,000 children are diagnosed globally each year. BMD affects approximately 1 in 18,000 and 1 in 30,000 live male births. Unfortunately, there is no cure, but there is medication, assisted devices, therapy, which are ways to manage symptoms and slow the course of the disease. So some characteristics and common symptoms of Duchenne muscular dystrophy. So it appears to 2 to 5 years old. It affects the muscles, the hips, the calves. Early sign of pseudo hypertrophy, which is leg muscles, appears to be enlarged in calves due to scar tissue within the muscle. And then another thing of diagnosis or what people could identify is Gower's sign, which is weakness in the proximal muscles, the quadriceps and the gluteus muscles. This describes how a child would use their arms and to walk up their body to achieve the upright position. So I'm gonna take a moment to take a look at the graph that I looked here. So what tends to happen with individuals with DMD is that as their muscles are slowly deteriorating, it's progressing, like I said, on their arms, their legs. But for the calf muscle, what's happening here is that they look very enlarged. That's because of muscle scar tissue that is building up. And because of the weakness and the fatigue of it, the way that children tend to get up is kind of like face down, um, and then they lift kind of their body up in this kind of position to upright in order for them to keep on walking. Children with DMD develop contractures, so shortening of the muscles which prevent limbs from function. Cognitive problems, learning disability, fatigue and weight loss, respiratory problems, restriction of breathing, recurrent lung infections, difficulty of coughing. Scoliosis is another thing, and eating complications and swallowing are their common symptoms. For Becker muscular dystrophy, like I mentioned earlier, it appears between the age of 5 to 15 years old. And so this type of muscular dystrophy appears later on down the road. But the same common side effects as heart muscles commonly affected. The first sign can be heart condition, skeletal muscles weaken, scour sign, fatigue, weight loss, cognitive problems, balance coordination, respiratory and learning disabilities. So as you can see the graph, these are different areas where MD does affect how it affects the human body. Okay, so treatment for MD, there's various ways to try to, in a way, make it comfortable for individuals with MD, but as well as supporting them in order for them to do their everyday occupations. One kind of support would be wheelchairs or scooters that can help with mobility. Braces called ortho support, which as you can see on your left side here. These are different types of supports or splints that are usually worn at night uh, for people with MD. And also these, the wheelchairs right here. Assisted ventilation for respiratory weakness, medication such as corticosteroids, which help to preserve muscle strength function to prevent scoliosis. Other types of therapy with physical therapy, speech therapy, education, psychological interventions that can help with learning disabilities, and of course, occupational therapy that can help improve daily living skills. So for functional implications, some of the challenges that individuals with MD have is like difficulty walking, unusual gait, swaying from side to side, the planting of the feet unevenly, keeping balance by sticking their belly out while pulling back their shoulders, progression of muscles, deterioration causes children with DMD to fall, which their ability to walk. So by the age of 7 to 12 years old, a wheelchair would mostly be required because of the muscle deteriorating. So as they get older, it becomes very difficult for them to walk. So as I mentioned earlier on the previous slide about the keeping the balance by sticking their belly while pulling their back, their shoulders. As you can see here, this is an example of the position where individuals with MD would walk. So it will have like a curved spine. So this might be a sign of scoliosis, upper arms, shoulder griddle, other thing, the pelvic, hands and fingers, and also the foot plantation. So it's a foot dorsiflexion weakness that you will see that affects the muscles, of the individual. And other things too, is as far as like early loss of ambulation, which it would be like an individual cannot walk anymore, but still able to use their arms when not using a ventilator, maybe just at night. Most Duchenne clients starts early in the childhood versus those affected with Becker in adolescents and young adults. Late loss ambulation phase when a ventilation is needed, which at this phase, they have very little arm movement, hand function. And this stage, people are affected by having challenges to use their hands and maintaining posture. So the late loss of ambulation is a bit worse, which they will need a little bit more support. Okay, so the impact of development, so developmental delays is evident to occur a few months after birth. Intellectual and cognitive abilities are also impacted. Some examples I can mention here is gross motor activity, bimotor, language, speed, adaptive behavior, personal social behavior, depression, as well as social interactions. There is a comorbid conditions that can include autism, as well as attention deficit hyperactivity disorder, ADHD, and obsessive compulsive disorder. Learning disability areas of talent and challenges that they notice with individuals with muscular dystrophy is that they have a hard time with attention, with verbal learning, memory, and emotional interaction. Okay, so as far as our roles for occupational therapists who could help individuals with muscular dystrophy, I mean, our role is to evaluate the physical, psychological, academic, and social needs. At this moment, we could support individuals with MD by, doing a simple occupational profile, a parent interview, seeing how we could help them live comfortably and still be able to be independent regardless of their disability. Our goal is to, for them to participate in occupational performances that are meaningful, that correlates with, their roles. So another thing, Tennington tools are to compensate for loss of strength and dexterity. Another thing that's important, our role as occupational therapists is to make sure the environment is modified as well as task. Assessing the home environment to see where different types of modifications I could be included in order to make occupations a bit more easier, as well as the individual to do things independently. Some examples could be like adaptive utensils, dressing aids, compensatory movements and position, wheelchair accessories or communication aids, because as well as mentioned that speech is one of the common symptoms that individuals with MD have, and going over safety precautions and access to education to ensure the environment is accessible to the person's needs. So this is very important to see how how the child could still get a proper education as well as making any kind of adjustments needed. So this is something maybe to include in a child's IEP, and as well as helping with other ADLs and IADLs. These are my reference. Thank you so much for your attention. I appreciate your time, and please feel free to leave me any questions if you guys have any. Thank you so much.